Hello, everyone, and welcome back to Talks with Izzy. Today, we're going to be talking about PrEP, and with that, I have my coworker here, Carla, who is going to help us with that. Hi, Carla. How are you?
Hi, I'm doing great. How are you, Izzy?
I'm fine, thank you.
Good.
So, what are we going to be talking a little bit on today? Is this like on a provider view, or is it what kind of information are you going to give us as to the questions that the community had?
Yes, it's actually going to be a conversation among a provider. She supplies us with this information that she gets most frequent asked by her clients when they come in to get information about PrEP.
Okay, awesome. So let's get started. So the first question is, what does PrEP entail?
PrEP is a regimen of one pill a day, and it can be taken any time of the day, morning or afternoon, with or without any type of food in your stomach.
Okay, and does Native Health have a specific PrEP program?
We do have an actual PrEP program where folks who are at high risk of acquiring HIV can come in and talk to the provider about it. It will entitle to come in and have lab work done, appointments every 2 to 3 months so they can redo labs and make sure that everything is taken care of. And they remain negative, of course.
Okay, awesome. And so then the next question that I have here is, does PrEP protect against other STIs aside from HIV?
Absolutely not. And I'm glad that you asked that question. A lot of people feel that just by taking PrEP, they are already taking care of everything else, and it doesn't work that way. PrEP is only covering you for HIV. All of the other STIs could be acquired by not using protection, and that's one of the reasons why we check all of the STDs every time they come in for labs.
Okay, so then that leads me to the next question. Is how soon does PrEP become effective after you start it, and how long does it take for PrEP to become protective?
So PrEP taken daily, it's 99.9 accurate, so it's pretty safe. And the way the providers usually explain to our clients when they come in, it takes anywhere from 2 to 3 weeks after taking the medication for PrEP to be that accurate.
Okay.
Of course, if we go into detail, then we can talk about what site is being used for sex. But in general, 2 to 3 weeks, it's the max time for PrEP to be in your system and for you to be comfortable without exposing your partner. But it's recommended to use condoms most of the time, of course.
Okay, so then kind of depending on the person and what type of sex they are having, that's a conversation they need to have with their doctor to see the maximum effective time to wait.
Most definitely.
Okay, perfect. Thank you so much. And so then the next question I have here is, if I take PrEP, does this mean that I have to take it for the rest of my life?
No, you can take PrEP as long as you think you need it, based on your sexual life. If you don't have a partner, a committed relationship, if you want to have more than one partner, and obviously you're putting yourself at risk, you can stop PrEP the minute you think you don't need it any longer.
Okay. And then moving on is, someone has a concern about the pill is making me nauseous. What can I do?
One thing that I have heard one of our providers mention a lot to our clients is try to change the daytime, basically the time that you take the pill. If taking it in the morning is making you nauseated, then try to take it at night. Try to take it with a snack or after having a meal. Just kind of play around. As long as you take it on a 24-hour regimen, the pill will work.
Okay, so then maybe it'd be best for some people to take it at nighttime so they can sleep through.
That's right.
Feeling nauseous. Okay,
Yeah.
That's a good recommendation. Thank you, Carla. And the next question is, a lot of people are worried about the cost of PrEP. How does that work?
And I don't blame them. That's one of the reasons why we really have to emphasize that the education portion about PrEP. Mm-hmm. PrEP is expensive, of course, but we have ways of getting the patient into an actual patient assistance program that is offered through Gilead, which is the pharmaceutical that produces the medication, and they don't have to worry about the actual payment. This applies for patients that have insurance and the ones that don't have insurance. For the ones that have insurance, they can go ahead and help pay the copay portion of them, so that way they don't have to pay anything out of pocket. And for the non-insured, of course, it's going to be completely free, and it's an application that they have to do and re-enroll every 12 months.
Okay, And so, as Carla was saying, the information is here on the screen. So if you would like to write down the website, you can go ahead and apply online yourself as well. So moving on to the final question is, I am nervous about talking to my health provider about PrEP. How should I bring it up?
One of the easiest ways to actually have this conversation with your provider is, if you know anything about PrEP or if you're just curious about it, just ask the main question that should come out to you, from you. It's, what is there to know about PrEP? Or can you tell me a little bit more about it? So they can actually have all of their questions, answered by their provider on their visit. But if by all means anybody has any questions, feel comfortable to reach out to us. We can always guide you through, or just give you a couple of questions that are the most frequently asked to our providers, so they can feel comfortable having that conversation.
Okay, thank you so much, Carla, for all your knowledge and for being here with us today to answer these questions. So our contact information is here if you wanted to reach out. Again, these are questions that were provided to us by a provider of the most commonly asked, and the answers are from community educators, not from a provider's perspective. So if you have some questions that you need further detail in, or if you have further questions, you can go ahead and reach out to myself or to Carla. Our information is back here behind me. And thank you so much for joining us today. Thank you, Carla.
Thank you.